Oof. Yeah, if your chiro is making sound effects, it's usually, or your arm teeth, it's usually a pretty good indicator. That,
should always be the other way around.
Yeah, really, because we're getting a little rope of activity right there. We're getting the feet kicking down there too. Good.
Oh, yeah.
There we go. Same concept, okay? Just drop into this hand. Good.
Ooh.
There we go. Proper. There we go. Breathe. These can
feel it.
Little pinchy on insertion for certain. Hey everyone, today we've got one of my favorite patients. She's a life coach and also a mom, somebody who gives from the absolute bottom of her heart to help everybody else. But when you're trying really hard to help as many people as you can, it's also important that you yourself take the care that you need for yourself. And that's kind of where manual therapy can come in. I'm excited to have her on the channel today. Hope you are as well. Don't forget to hit the like and subscribe button, and thank you so much for your support. Yasmin,
yes.
Thanks for coming in again today. So Yasmin has to be one of my favorite patients.
Aww.
Very, very loving and caring individual. She's a mom. She's also a life coach. So she's pretty much dedicated the entirety of her life to helping out other people. All right, and I think we all need like thousands more of that kind of individual in the world. Yasmin, you've been coming for a while.
It's my time to get help now.
Yeah, so that's the point. If you're helping people all day, you need to get help for yourself sometimes too.
Yes.
But what's going on with you today, Yasmin? Is it the usual? What do you usually come in for?
I usually come for my neck.
Mm-hmm.
It starts being stiff, and then very tight and painful. And then, as always, sometimes I ignore it, so it goes down onto my arm. But I learned the hard way. I learned my lesson not to ignore it and not to delay it. So
good. I'm very happy you learned that.
I am here to just be on time for
Perfect.
just some treatment, and it's actually when I leave it, it doesn't only transfer to here. My migraines get triggered.
If you ignore it, when you ignore it.
Yes, of course.
Okay,
when I ignore it and I delay treating it, and
So we like to obviously make sure our patients don't get headaches. So thanks for coming in. How's the upper back and the lower back feeling today? Usually we do those as well within there.
They're tight as always.
Tight as well.
Yeah.
So just
because if I do a lot of driving, and
your kids are in sports, right? So you're going everywhere. Totally.
Yeah, when you have kids in swimming and you drive in the morning and the evening and you do work in the middle. So
I remember being the kid in that scenario.
Ooh.
So, it's not.
Tell me, can I get better?
It gets better when they stop swimming.
Or they start driving. So
or they start
either
driving.
or,
that too. So just creeping up, and Yasmin kind of feels the exact same as she always does. We're getting a little rope of activity right there. We're getting the feet kicking down there too.
You know, when the leg is up, it's there.
When the leg is up, the pain is present, very much so. Wow, actually, you are actually more tight than you normally are. I'm going to start with a massage gun for you, okay? Yeah, yikes.
I always make your life harder. I know.
You do, but do you feel that there?
Yes.
Okay, so you guys obviously can't feel this, but as I'm rolling right there, you can actually feel the knot slide right under the finger, and you probably hate me for doing this right now. But okay, there, you can kind of see the little tiny. There's another one right there. Okay, you know we're gonna have to definitely soft tissue that quite a bit when you're sitting up later. Oof. Yeah, if your chiro is making sound effects, it's usually, or your arm teeth, it's usually a pretty good indicator. That,
should always be the other way around.
Yeah, really. But me, I'm like, oh my god, this is work. That's okay.
Oh, good.
Take this. I'm gonna pull you off the shoulder here. Good. You can hold right there. Bottom leg straight, top one bent.
Oh god.
You're from it. What? Oh god. Oh no, I'm scared now. Okay.
You're not gonna drop me off the bed, are you?
I haven't done that before.
Yeah, but it's always there.
I don't want it to happen on camera. Okay, I'm gonna roll you towards me.
Okay.
Good. One more try there. There we go. That was a big one. That was a really big one. I want to take a second and just highlight Yasmin's shoes. I think those are actually some of the fanciest shoes with like ribbon laces. I think those deserve a highlight in the video there. That's good. Okay, we're going to reposition you here. I'll take this. There you go. Relax right there. Good. Bring this up. Same concept. Again, you're not going to fall. Okay? I promise you.
I think I trust you by now.
Yeah, how long? You've been coming here like 3 years.
It's about time to trust you.
Exactly. I'd hope so. Gosh. Okay, breath in. All the way out. And sink into the table. There's another one right there. Good. How you doing?
I'm good.
You okay?
That's the scariest part now, but I'm not.
The neck adjustments?
But I'm
These still scare you?
Absolutely not.
I'd hope not.
Look at me now.
You're allowed to be scared the first few times
I'm
you
gonna
work,
be a
but-
tough cookie now.
Good. Okay. Did you intentionally match your blue jeans to your nails today? I gotta say, 'cause that's another thing. Just like you're so well put together today. Yes, I mean that. I mean that unironically. Okay.
Oh, thank you, though.
Compliments are free.
Are you trying to distract me?
I am. Yes.
Okay,
Yeah.
smart
But
cake.
you're too smart at this point. Gosh darn it. Ooh. Okay, so we're definitely gonna get that section right there. So to do that, the same concept. We can get you to drop that head into my hand right there. Good. So Yasmin's at the very top, the C1, C2 area of her neck. To get that, I need her to be very calm. Oop. Wow! Okay, we'll come back and revisit that in a second.
Okay.
Let's try the right side instead. Drop that head into my hands. Just relax if it's a pillow. See how that muscle turns off right there? That's good. So again, same concept. Stay relaxed in this hand here. You can see okay? Good.
Oh, yeah.
There we go. So yeah, it's definitely not me, it's you. This is
It's always me.
This is a very stubborn thing to deal with, but that's okay. We moved the right side. Let's see about getting the left. Okay, let's come back here and visit this once again. Same concept, okay? Just drop into this hand. Good.
Ooh.
There we go. Whew. Mucho better.
God.
So sometimes if we... Sorry, that was Spanish because you were in Mexico, right? Mucho better auto. Now sometimes if you can't get a side to go initially that's really stuck, getting some movement on the opposite side does make it easier to come back and revisit, so it's worth exploring it twice. Yeah. You never want to force these things though, because that's how you'll hurt somebody if you just go too hard.
Oh, this feels good.
I hope so. Trying to make you taller a little bit. I need to make sure you're taller than Salim still. That's not happening anymore. Is he taller than you now?
He's almost there.
He's almost there.
Yeah,
Okay,
and
we
I
gotta
can't
keep
borrow
it.
his shoes anymore, so
I'm
we're
sorry
done
about
that
that.
stage.
That's so cute. That's so precious. Oh, man. Good, and slowly down into the left. Ooh.
Oof.
Up and to right. Slowly down to left. Can we actually... Oh, we can see that. Hey, Jess, if you actually come around here for a sec. So, like, I'm going to use my elbow here. But if you look closely, you can see her muscle literally down to left. Wait for it. There it is there. It literally slides because she feels like she's got wires in here. So, you're good, you're good, you're good. Breathe. Breathe out. Awesome. Didn't slide that. Oh, wait. There it is right there. Okay, good job. Yes. Put the fists away. She's like making a fist. I'm a little bit scared she's going to swing at me. Let's breathe through it, okay? We got a few more sessions to go. I just want people to kind of be able to actually see, and it's rare you can see a slide like that. So I'll get you to look up and to the right. Once again, slowly down to the left. Good, up to right. Slowly down to left.
Yeah.
So you as a life coach, I wanted to ask, like, what, and slowly down to the right, if you're able to talk and MRT at the same time, life coach, what do you find the most rewarding aspect of your job to be? I know you primarily work with people who are going through life transitions. And also, do you offer virtual services or no?
Yeah, I do.
Okay.
I do offer in person
And
virtual.
So what's the most rewarding aspect of your job?
Is this when my client feels or discovers a new potential in them, or actually discovers their potential, and they feel that they're not stuck anymore where they used to be?
So what would be like a good example if someone's watching at home right now like to suggest that they should see a life coach. Not necessarily you, but maybe you.
Yeah.
You know, if you want to, you can.
It would be nice if it.
I'll find her online booking link. We'll put it in the description below. Sarah, don't let me forget that. And slowly down to right. But what are some signs that people should be seeking services from a licensed life coach? Excuse me.
Yeah, some of the signs are usually when people are in the middle of a big change and they feel overwhelmed, scared, and
sorry, I'll just get you to face forward, tilt left ear to left shoulder, and then keep going. And
they don't have clarity on what's the next step.
Mm-hmm.
All of this ambiguity creates a lot of different emotions, which affects usually how you feel about yourself and am I capable or not. And all of this self-doubt starts, and burnouts and so on. So when I work with people in transitions, I help them reach this clarity, and we co-create kind of an action plan.
Okay, good. I really like
step
that you're doing an action plan, because action plans are what actually implement change, right? It's one thing to sit and talk, and obviously empathy is important, but without actionable steps, kind of still going to be in square one.
And that's the beauty of life coaching. Life coaching is make sure you live up to your potential. So if you're not going to make a change, how would you reach this potential?
Mm-hmm. I like that. It's taking some of the fear out of the change aspect, right? That's good. Because
you won't be alone. Yeah, we'll do it together. So
you'll have a teammate.
Yeah.
Get you to shrug the shoulders up for me. Thanks for sharing about that. And slowly lower down. Good. Up. Slowly lower. Up. So anytime something's going on under the skin, we always want to take precaution. All right. So some sanitization. Got me in here now. Fun fact about actually skin sanitization. Statistically, it doesn't make any difference in rate of infection versus not sanitizing. That being said, it can definitely calm people down, and the optics make it look like it's clean, so we're going to clean it regardless, because, we're going to clean it. Okay, so that's all good. Take the gloves off here. I don't need them. I will sanitize my own hands. Alright, needles o'clock. So let's get in close and make sure we can actually see these here. So, coming in, base of the neck, into the suboccipital muscles. You'll notice that the needles have a sheath on them, a safety sheath. Stab like that, and we'll be able to push right in like so. There we go. There's one. I think we'll be doing potentially 6 today. I'm not 100% sure yet. We'll just kind of see as we go along there. Yasmin, you okay?
Mm-hmm.
Good. Yeah, try to keep your arms still there, okay?
Okay.
There you go. Mm-hmm. Ooh. There we go. Alright, so this is kind of around the base of the skull, the occipital region. Now we're going to go down a little bit more into the C-spine paraspinals, or the muscles actually around the C-spine proper. There we go. Breathe. These can be a little pinchy on insertion for certain. Good job. Last one. Okay, we made it. We out here. We did it. Good job, Yas. It's been about 10, maybe 15 minutes, so we're going to get Yasmin off the needles now. So we're going to start twist and pull, twist and pull. Sometimes they can pinch a little bit on removal, but just sit tight for me, okay?
Oh, yeah.
Yasmin, did you eat lunch today?
I did.
You did? Okay, good.
Yes.
Sometimes we can get a little bit of dizziness if we get up a little bit too quickly, but go ahead, get up nice and slow, take your time. You don't have any bleeds or anything?
Woo.
There you go. Welcome back. Good to see you.
Woo!
Feel like you had a nap?
Yeah, that was a good one.
Good. Okay, so
Thank you.
That's pretty much all for today's treatment then.
Yeah.
Okay, thanks for coming in. Did you have any questions for me at all before we sign off for now, or?
I'm good. I think when do you think is a good time to have my next treatment? Like in 3 weeks?
We're on like a 3-week schedule,
Right?
so I think I'll book you in for then.
Okay.
There you go.
Then
all right.
I'm in for 3 weeks.
I will. All right. Very good to see you again. Yes,
Same
thanks for
here.
coming in.